All right. So, hi, everyone, and welcome to the December Sigma Xi monthly seminar series. Welcome, and we appreciate your being here. So just a couple items of business before we get started with our talk today. Don't forget to renew your membership. We have the link there. And if you need help in doing that, please reach out to us at our email, sigmaxiuab@gmail.com. And from headquarters, a couple items of business. So there is a special call for papers with a deadline of January 23rd, 2022, re-envisioning STEM education and workforce development for the 21st century. And then remember that we have our Sigma Xi Grants in Aid of Research program for undergraduate and graduate research with the deadline of March 15th. Don't forget to nominate requested or recommended seminar speakers. We have our email there where you can reach out to us, and nominations for membership consideration as well. So we invite you to nominate individuals for the monthly seminar series, and we look for diverse scholars in all walks of professional life, including senior and emerging scholars with university appointments, as well as researchers and scholars working in policy think tanks, national associations, school districts, state education agencies, foundations, and higher education settings. And one of our main aims is to enhance awareness of underrepresented scholars and their research on and beyond campus to promote diverse, equitable, and inclusive scholarly interest and collaboration. So we have the process there for nominating a scholar. Please reach out by email to our chapter Gmail there with your nomination for the speaker with their contact info, a short summary of why you're nominating the potential speaker, and details of their professional background. And don't forget to stay connected with UAB Sigma Xi. So announcements for the seminar are sent out via our email list. So like or follow the UAB Sigma Xi page on Facebook as well. Reach out to us by Gmail to be added there. And we also have our YouTube channel where we upload the talks. So make sure to stay in touch that way. Just wanted to recap a few of our seminars that we've had recently. The fall seminars, we had Dr. Cardell, Turning Chutes into Ladders for Women, a Roadmap to Equity in Academia. That was our talk in September. And then we had Dr. Ilias Parakis on a quantum leap into the future of work. And then we also have our fabulous speakers here today with their talk on increasing COVID-19 vaccination rates among Black residents in Pickens County, a mock campaign. So plan for spring, we have the Alabama Scholar Strategy Network group and Sigma Xi co-hosting a workshop on public policy. And the topic there is op-ed writing. So that's really an exciting workshop that's coming up soon. And we'll announce a date a little bit later on once that's decided firmly. And then we also have Darwin Day, February 7th. Without further ado, I would like to introduce today's talk. So today's presentation is given to us by 3 University of Alabama doctoral students in the Health Education and Promotion Program, Jala, Lockhart, Megan Williams, and Ny'Nika McFadden. Our speakers will present their winning mock campaign from the Society for Public Health Education's Eduthon competition. The talk is increasing COVID-19 vaccination rates among Black residents in Pickens County. So to introduce our speakers today, Ny'Nika McFadden has a Bachelor of Science in Psychology from Torrey University, a Master's of Arts in Communication Studies from the University of Alabama, and her interests include patient-provider communication, patient education, patient engagement, medication adherence, and health literacy. Megan Williams has a BS in Public Health from East Carolina University with a Master's in Public Health with a concentration in Health Education Promotion from East Carolina University, and her interests include reproductive health, sexual health, and college health. Jala Lockhart has a BS in Food and Nutrition and a Master's in Public Health from the University of Alabama, and she is a dietitian tech registered and certified health education specialist, and her interests include holistic health, minority health, community-based participatory research approach. So without further ado, I'm going to stop sharing my slides and hand it over to our wonderful speakers today. And just a reminder to put your questions in the Q&A, and we will save them for the end and for our speakers. Thank you all.
Thank you so much for having us, Dr. Ass, and the Sigma Xi chapter. We are honored to be here today. I'm going to go ahead and go in presentation mode. Can everybody see my slides? Awesome. So as Dr. Rass mentioned, my name is Jala Lockhart, and I'm honored to present today with Megan Williams and Ny'Nika McFadden. We are second-year doctoral students at the University of Alabama in the Health Science Department. Before we get started, we would also like to thank Dr. Amanda Wilkerson for her mentorship on this project. We could not have done this without her. And we're very excited to talk about how we would, if this was a real campaign, improve vaccination rates in Pickens County. And so we'll go into a little bit of detail about where Pickens County is and why this is important. And then as just a quick note, if you could have your cell phones handy beside you and with the camera feature, that would be great. And we have no conflicts to disclose.
So to give you a little bit of background about this competition, it's put on every year by the Society for Public Health Education, sometimes denoted as the acronym SOPHE, and it's called the Eduthon. So this is a scenario-based competition where undergraduate and graduate students are able to demonstrate the information that they've learned in their public health degree in a competition form. So they get a choice of 3 different scenarios, and they are going to create their response. They're going to come up with a response. So the 3 options were combined community approach to vaccinations, which is what we chose to do, community health communication and social media, and school-based health centers. So teams of 2 or 3 graduate students or 3 or 4 undergraduate students have the option to participate in the competition, and there's 1 winning team from each of the groups. There's a limit to 6 graduate student groups and 12 undergraduate teams. As a note, there can only be 1 undergraduate team and 1 graduate team from each institution. So it's important, if you're interested in participating, to make sure you talk to your chair to get that approved before you decide to participate. So on the day of competition, you get 30 minutes to display your presentation. Ours was originally 15 minutes, so we got to expand this after we presented it for the first time. And then there's 10 minutes after that for question and answers from the committee that's deciding. So if you're interested in competing or registering, you can register by January 31st. And the competition day is during SOPHE's annual conference held on March 22nd. It is a virtual conference this year, so students will be eligible to participate online. There is a $50 registration fee. However, our department covered our registration fee, and that may be something that your department may be able, or your wonderful organization may be able to cover. So each member from the first place team received a $150 cash award. They got a SOPHE award certificate recognition, and then we had the opportunity to present this presentation at a SOPHE webinar, and luckily now for the 3rd time. And so really great opportunities to expand your networking, work on your communication and oral presentation skills, and the cash reward is really nice. You do need a faculty mentor, so just keep that in mind, somebody that might be willing to sponsor you. And if you want more, you don't need to be a member of SOPHE to participate, although it is recommended. And if you'd like more information, you can just go to sophe.org and look up their annual conference, and it should have more information about the Eduthon. If you have questions about how we prepared or would like to connect with us, we would be more than happy to do that after the presentation.
Thank you, Megan, for sharing that. So let's get into a little bit about the competition that we decided to do and how we did it. So for the purposes of this competition, we were tasked with using digital resources to create a plan that would assist the health department. And we wanted to make sure we did this through evidence-based recommendations. And so our goals are really to increase the vaccination rates in Pickens County and to apply digital health communication strategies to do so. And then we also, they had like a little bonus category, decided to take it up a notch and also use evidence-based interventions for vaccinations to enhance the provider side of things. So before we get into the actual campaign itself, I always like to start off with a little bit of background, and this will describe why we ended up choosing Pickens County. And so back in April, when COVID was unfortunately rampant and things were kicking up, this was also at the time where we originally presented. We know that vaccine administration was ramping up in the US. And so there were about 208 million shots given at that time. Yet we do know also at that time that we were starting to see distribution was not equitable for all communities. And so if we look at the red bar chart here, we see about 8% of African Americans had nationally had been vaccinated. And then we also see by the map that our state of Alabama was behind the pack in the vaccine administration overall. So also at the time of competition, the Alabama Department of Public Health shows us that Pickens County had only administered about 5,700 doses of the vaccine, and about 218 shots were given on their best day. And so this will be important for our evaluations and objectives later to decide how many shots we could kind of think we could give out in a day. Specifically for Pickens County, the Alabama Department of Public Health data also shows us that in the circle graph, the rate for African Americans receiving the vaccine was lower than the white residents of Pickens counties. And the bar chart shows us that the rate of African Americans trying to get the vaccine was higher than other groups. And so again, this was a little bit of the background data that we use to kind of select in our priority population. Another thing that we decided to look at was where are the vaccinations being given in Pickens County? And so this map shows you that there were only 4 locations where in this whole county residents could get vaccinated. One was a pharmacy, a primary care clinic, the public health department, which was actually in what they call the Pickens County Public Health Department, which is in only one city seat of that whole entire county, and a family medicine clinic. And so we actually got to drive out to Pickens County because, as you can see, it's not too far from where we are in Tuscaloosa. And so we wanted to do a windshield tour. And so these photos are actually from that tour, and you'll see that this was a mobile command center that we don't know if it was still in use or just parked behind the building to be used at a separate time, but you'll see that there was some very rural counties, and Megan will give us a little bit of background on that.
Thank you, Jala. So again, to give you a little bit more information about Pickens County, the town that we're working with here, it's considered to be rural. And it's important to note that a lot of the interventions we looked at to base our intervention off of to only talked about urban areas. So we really didn't have a lot of guidance for what we were supposed to do, but we know that there's not a lot of interventions in general out there for rural areas. We know that rural areas typically tend to be small knit communities, lots of talking, lots of community engagement. And so that was going to be really important because we could use people in the community to be able to spread our ideas and get word out about our vaccination clinics that we were going to do. Specifically, people in these communities would be farmers, government officials, pastors, clergy. Those would be the people that we're going to try to use in our ad campaigns. And you'll see that when we look at some of our ad campaigns a little bit later. It's also a medically underserved county. So this basically means that there's a score from 0 to 100 with a score of a 60 or lower being medically underserved. So we know that there's a lack of primary care, dental care, and dental providers in this area. As you can see on the left-hand side here, there was only one medical center in the all of Pickens County, and it actually closed right when COVID started. So people who needed to get medical care had to drive to Tuscaloosa, which is about between 40 minutes and an hour, depending on what side of Tuscaloosa or what side of Pickens County they were on, or they had to drive to Mississippi, which would be on the western side. Their economy is all about agriculture. So they're in poultry, swine, and trees. And this is really important because these people don't typically have options to come off of the farm or wherever they are to get shots in the middle of the day. So we had to think about this when we were creating their vaccination options for after work hours and weekend hours and late hours to allow them the ability to be able to get the shots when they needed them. Also, these are really important people. You think about these people are making our food, they're growing our food. So we need them to get vaccinated so that they could get back to the fields or wherever, production or wherever they were so that we could get them back to work. There also is only about 88% of people in the US had a high school diploma, and only 81% of people in Pickens County had a high school diploma. So this might just tell us a little bit about their literacy levels. And so we know that we might need to make ads or target their ads to their literacy levels, which we'll talk about a little bit later. And one other important thing to note is that there might be some medical mistrust among this population, given kind of the historical events that have happened in Alabama. This was something to keep in mind when we were creating our ads and our campaign. So we really wanted to create a tailored approach, given all of these characteristics about Pickens County and the people in Pickens County. So as you can see, Pickens County is this red little blob. It's on the western side of Alabama, right near the Mississippi state line. It has those 4 major cities, Gordas, Aliceville, Carlton, and Reform, and we decided to put our vaccination clinics in a couple different areas to spread it out across the county. It's considered to be distressed, which is made up of a couple different things: how many people aren't working, what's the poverty rate, the median household income. But it is considered to be 93% distressed, meaning there's not a lot of resources in this area. It's about 20,000 people, about 60% white, 40% African-American. It's even among males and females. There is a considerable amount of the population that's 65 and older. So when we're creating parts of the campaign, we had to keep that in mind, that they might not be as familiar with online resources and might have needed some other types of resources. The household income was only about $37,000 compared to about $65,000, which was the national average. So these people may not have as many financial resources. And so just another thing to keep in mind. So all that to say that our target population was Black and African-American eligible participants in Pickens County, given that there were eligibility requirements back when we did this in April, and those might no longer be applicable. So how are people getting information in Pickens County? So obviously there's the newspaper, but let's be realistic. How many people are reading the newspaper these days? It can be kind of expensive, and maybe they don't have a permanent mailing address, and so they're not able to get it. The big thing that we're going to harp on here was those online resources. We know that online sources are one of the biggest way that people are getting information. You can see here on the lower right-hand corner, this Facebook page for the Pickens County Health Department. And it was really active during the kind of the peak of COVID. And then we realized that went downhill drastically, in kind of late 2021. But this would be where most people went to get their information. The Alabama Department of Public Health also had some decent information about COVID, but honestly, it really wasn't that great, and it was kind of hard to navigate. But one of the big things to note about this is that only about 76% of people in Pickens County had a computer, compared to about 90% of the national average, and only about 66% of residents in Pickens County had Wi-Fi, and compared to about 80% of the national average. So less people have access to a computer, and lack access to internet access. So, I think that just goes to show that, also, even if they have access to a computer and they have access to internet, they might not know what to do. They might not know what to click on. They don't know what buttons to click. And so especially for older adults who might not know how to navigate those spaces, it was important to create parts of the intervention that really harped on that in-person or kind of snail mail idea that we ended up using. I think email is another one. You can see Gmail might be an option, but people are overloaded with their emails and it might get lost in a spam folder. So that really wasn't a great option. Kind of going back to that small knit community, people might be talking through word of mouth, but as we know, you've ever played the phone game, information gets lost, or, you start out saying one thing and it ends up as another. So that's not necessarily a reliable option that we really want to focus on. So that's another thing to kind of keep in mind. So here's just some information about all the different types of communication, and we tried to really keep that in mind when we were creating our intervention.
Thank you for that, Megan. So let's talk a little bit more about our mock campaign components. So remember, the overall goal was to enhance or increase the COVID-19 vaccination rates among Black residents of Pickens County. So to do so, we wanted to focus on, one, increasing the community demand of vaccinations, but then secondly, also enhancing the access to vaccine services. As Jala mentioned earlier, there was an additional component, which Megan will speak on later, about the provider assessment and feedback that helps with the evaluation process of the mock campaign. And something to note too, is that because it's a mock campaign, I want to specify that if we were to have actually developed this campaign, we would have secured 525 doses of Johnson & Johnson vaccine, because at the time that was the vaccine that we had selected. And so now I want to talk to you all about the tailored messages. So earlier we talked about the target population being Black residents within Pickens County. And so to be more specific, when it comes to communication and messaging, one thing to note is the messengers are important, and also how do you address vaccine hesitancy or concerns that they have about the vaccine in general. And so formative research, which is conducting a focus group, meaning you speak to 5 to 9 individuals to collect data from them. Unfortunately, focus groups can be time consuming. So another way to collect data is through a survey. And the Alabama Department of Public Health distributed a survey to at least 1,000 Alabamians. And they asked questions related to who did they trust the most. And the percentages that you all are going to see is ranked from somewhat agree to strongly agree. So meaning that at least 49% somewhat to strongly agreed that they could trust their receiving health information from their local nurse. At least 48% said that they somewhat or strongly trusted receiving information from local doctors, 34% religious leaders, and 42% of medical providers who were of the same race as them. With creative strategies, it's important to think about it from a cultural component, meaning incorporating football, for example. Here in the South, football is very important to us. Recently, we had the Iron Bowl. So Roll Tide, we're representing the University of Alabama, so I have to put it out there. And incorporating football is important. So on the right, you'll see in the visual aid that Jala actually created, where there's football and family gatherings. And this is important to note because the Alabamians in the survey mentioned that if football or family gatherings was mentioned in messaging, that would promote them to be vaccinated. And the score that you all saw in the top left corner was the Clear Communication Index score, which I'll have Jayla to talk about later. So the theoretical framework, we were required by SOPA to at least select a theory, and we believe that the health belief model would be the most appropriate because based off of the constructs such as barriers, benefits, self-efficacy, and cues to action, meaning to actually take action to get vaccinated, are important to talk about within our mock campaign. Now, because this is social marketing, it's important to talk about the 4 Ps, which are also known as the marketing mix. And the 4 Ps are product, price, place, and promotion. Now, product is the actual behavior that we want a priority audience to actually practice, which is to go receive the COVID-19 vaccination, specifically the Johnson & Johnson vaccine. Now, the price can have tangible and intangible components. So tangible could mean a $5 gift card incentive to actually promote them to get vaccinated. But intangible could be maybe the hesitancy to go get vaccinated because maybe they have a fear of needles, or because the vaccine was novel, they had concerns about how quickly it was developed. And also the time that it would take to have to take off work. And also, as Megan mentioned earlier, with their local clinic, unfortunately closing right as the pandemic really hit, having to travel far to get vaccinated may not be as convenient. Now with the place, this is where you want your priority audience to actually practice that behavior, but also a location that's centralized that can help promote the behavior to be performed. So for example, we wanted to select the library to actually have vaccine navigators to help individuals sign up for appointments, the mobile clinic at Piggly Wiggly, because as we know, groceries are essential. So a lot of individuals will go there to shop. And so having that mobile clinic on site is where the actual behavior can be performed with the drive-through clinic. And then the Pickens County Community Action Center. So we did our research and we noticed that they already had a community center. So that's convenient to have educational sessions to actually have open conversations about why are you hesitant to get the vaccine, or let's clear up any kind of myths or rumors about the vaccine in general. And the promotion, this is how we want to disseminate our messaging. So that could be through a postcard or through phone calls and text messages to actually remind people to get vaccinated once they have signed up. So let's talk about the 4 different various methods of actually delivering health communication messaging. So one that's interpersonal communication, that could be face-to-face. So this could be one-on-one, or it could be within group sessions. So as I spoke about earlier with the Pickens County Community Action Center, having a small group of educational sessions would be an example of interpersonal communication. And then secondly, we have small media. So that could be postcards, that could be sent out to the mail. And then we have thirdly, mass media. So this could be social media. As we know, in 2021, it's prevalent for individuals to seek out health information or just use websites in general. And then lastly, we have the billboards and radios that individuals could use. So we're dealing with a priority audience who may potentially be older, and so they may still listen to the radio. And it's important to have various components, because within these various components, it can help disseminate the information more. So for example, some individuals may not be able to go to educational session. So then they miss out on the opportunity of receiving information. However, they might like listen to the radio, and that still gives them an opportunity to listen to the message. Sometimes various channels can also allow repetitive messaging to make sure that an individual has longer recall for remembering messages.
So now I'm going to give a little bit of information about demand, which was our second thing we were trying to accomplish. So we were going to do a multitude of different things to try to increase the demand for our campaign. I think Jayla's going to give us a little bit more information about it.
Yes. And so as Ny'Nika mentioned, one thing here is that you'll see that we have a final percent score up here at the top of this graphic. And so we wanted to make sure that when we were creating these messages that they were tailored and informed by the data. The CDC also has a very nifty clear communication index that allows us to check and make sure that these messages would be well received on a multitude of levels, such as literacy, for the audience. And so each score or each graphic has that little score that would tell you that 100% means this message should be well received and understood by your audience. For the sake of time, we won't go into all of the community partners that we use, but you'll also at this point take out your phones, and if you could go to your camera and scan this QR code at the bottom of the graphic. As Ny'Nika mentioned, we would mail something like this or put something like this in the mail, but then there would also be the connection to more resources. You can only put so much information on a little 4x4 card. And so we created a website just for the Pickens County resident to be able to have this information in a really, I guess, concise place or a convenient place that they could access it. And so we also knew that we could not have a successful campaign without education. And so as Ny'Nika mentioned, we would want to hold educational sessions at the Community Action Center. And to do that, we would also, promote that as well. We recognize that hesitancy was a barrier to the vaccination. So holding these Q&A sessions prior to the vaccine distribution that we would do could help answer any of those questions, again, dispel those myths, and actually help people sign up for their appointment at that Q&A session. Again, we would use the media sources such as the TV and the mail to be able to display all of this information and also educate people on their eligibility for the vaccine. And then as Megan mentioned, the Pickens County Health Department website left something to be desired. So that's where having this website custom to Pickens County would just make it handy. And we really did love being able to use this website and think that it kind of gave us a leg up in the competition. We also wanted to make sure that we pilot tested all of our materials. And so we would do that at the Community Action Center while we were getting to know some of the people there. We would also maybe use some of our materials and get their feedback to see if they felt that it was culturally appropriate for them.
Yeah, it's definitely, I would recommend finding somebody with a creative eye that's good at this stuff. Jala was instrumental in creating all of our ads and our campaigns, although we helped a little bit. She was really the mastermind behind all of that. So kudos to Jala. So Just a part of our a project had to include evaluation objectives. And so we created objectives related to the different areas or the different types of products that we did. So we were going to make Facebook posts talking about, common questions people had or myths. We're going to send out informational cards to people in the mail for our folks 60 and older who might not know how to use the internet as well. We were going to hopefully host three Q&A sessions. And so our evaluation objectives are just displayed here for you to see a little bit more information about those.
And so one thing that we haven't mentioned yet is that the selfie competition also wanted us to use what they call the community guide, which is this awesome resource of just a lot of evidence-based resources for anybody who's looking to do anything about community health promotion or health education. And so through that website, we were able to see that the literature supports the use of incentives to increase vaccination rates. And so namely that participants would be, more willing to seek vaccination if they know they were going to get something like a reward out of it. And so for our particular project, we wanted to make sure that we would incentivize people to go shop at the Piggly Wiggly. So this was kind of twofold because we would actually want to host the vaccination clinic at the Piggly Wiggly. And so also this would help give Piggly Wiggly a little, return on investment if we could encourage people to go shop there after they've gotten their vaccine. And so, we just, again, wanted to use the parking lots at the Piggly Wiggly and then hopefully have that return on investment, showing them good faith and that we appreciated them letting us use their space. And if you're not familiar, if you're not from the South, you may not know what a Piggly Wiggly is, but it's just your regular local grocery store. But it's a place that we felt that everybody in Pickens County would know where they could get the vaccine and feel comfortable going there if there was a mobile vaccination site. And so Megan was really instrumental in saying also that this was a place where it was actually an essential task during the height of the pandemic. So you had to go get your groceries. So why not place the vaccination or place our clinic somewhere where it was accessible to people in a safer place. And then lastly, to increase the demand, we wanted to make sure that patients or residents were reminded of their vaccination appointments. And so, of course, we needed to do appointments because we didn't want there to be a mass of people. We wanted to make sure we had enough vaccinations to go around. And so we saw that in the literature, having these appointment reminders or having a recall system helped to increase the kept appointments from 38% to 51.6%. So we wanted to really make sure that by implementing this type of recall strategy, that we would also see an increase of those who follow through with signing up for their shot and getting their shot. And we would do this through text message reminders and or phone call reminders if they had access.
Thanks, Jala. So the second portion of our intervention was trying to improve access. So I'm going to talk a little bit about how we did that. So we decided to host 4 drive-through vaccination sites in different areas across Pickens County. You'll see here in Gordo and in Aliceville, kind of in 2 separate parts of Pickens County, so that residents from all over the county were able to get there. As you can see, we hosted them at various hours, so 7 a.m. before the workday and then all the way to 8 p.m. after the workday, so that people who were our target population were hopefully able to get there. Like Jala said, we held them at Pickens County, the Piggly Wigglies, because they were such an essential place, and hopefully people felt comfortable there. They knew where to go. We also had that lovely mobile health clinic that hopefully could get off the ground to come to the Piggly Wiggly to kind of be the headquarters and to hold all of the vaccinations. And our goal here was to give out 500 shots, or about 525 shots, which was based on the percentage of people that were vaccinated when we created this intervention, which we hope would be about a 10% increase from the people that were already vaccinated. We actually would use the fire department to help us kind of manage traffic and kind of the operational side of things, and get volunteers, local health care volunteers from clinics and nursing homes, hospitals, maybe in Tuscaloosa, to help us man the mobile clinic and actually give out vaccinations.
So a little bit more about the individuals that Megan just listed, which we wanted to call the vaccine navigators. And so the vaccine navigators, these are the individuals who could volunteer to help individuals sign up for appointments. So this could be your local community college students or local church members, right? This will help with funding. I apologize if you hear the lawn mower going. Sorry. And so the library is a good central location because some individuals, especially in a small area, they will use the library for services, especially if within the comfort of their own home, they do not own a laptop or a desktop. And so there's several ways that if we were to have actually implemented this campaign, several ways that we could help individuals sign up. And so that is one where individuals could actually come to the library and a vaccine navigator could sign them up. Or secondly, they could call and a vaccine navigator will help them sign up that way. But then also some individuals are hands-on learners. So maybe they do have a laptop or a desktop at home, but they're not really tech savvy enough to really know how to sign up on the website. And so a vaccine navigator can arrange a Zoom appointment and actually share their screen and walk them through on what to click on. And of course, that sometimes can increase their self-efficacy where they have this independence where they're still doing it themselves, but they're just getting more guidance through it. And so with the vaccine navigators, they can undergo training at least a month prior to the campaign starting. And the training that they can undergo could include how to answer the phones, being more informed and up to date on any of the myths or any information that is credible that they can share with participants, because some participants might call and they may kind of be almost close to wanting to get vaccinated, but still slightly hesitant. And so being trained with having credible information to give those callers can help really encourage them to just go ahead and sign up and get vaccinated.
So like my colleagues mentioned before, we kind of went above and beyond and did the third portion of this campaign, which was to really see how providers were doing, kind of a provider satisfaction or a patient satisfaction, and kind of to evaluate how they were doing, also known as provider assessment and feedback. So I found this wonderful tool offered by Stanford called the Mobile Health Map. And what this does is it basically it's an app that helps kind of evaluate events and understand their investment. So for example, it tracks attendance, financial return, and basically it helps people understand how this event is taking away or preventing people from going to the ER. So these preventative services, by getting vaccinated, what is our return on not going to the ER? And so we really hope that our target population would get a lot out of this event, and prevent them from going to the emergency room. So we would talk about this information to not only the people that funded it, not only health providers, but also community members to help them understand the importance of this thing. So if you're interested or you ever do a community health event, this app is free and available to anyone that wants to use it. If you Google mobile health map, it'll give you kind of a really easy video of how to set it up. And it can, again, kind of measure things like the number of vaccinations distributed, people who missed appointments, the number of missed appointments and people who actually got vaccinated, the demographic breakdown of people who got it. So if you wanted to know from which parts of Pickens County or maybe people from surrounding areas that went and got it, you could do that. And really the goal here was to have consistent communication between the providers, program staff, and even people who were receiving vaccinations to kind of understand the effectiveness of this of the clinics. So we would use tablets from local schools or even from the library, hopefully that they would donate to us to use for it. To kind of check in the system and have those throughout the actual vaccination clinics. And then we would check up after each different of our 4 vaccination clinics, and then at the end and distribute that information to local partners, participants, and funders. So here are numerous citations if you're interested where we got our information. you can check that out. And then we just wanted to say thank you and put up our contact information, plug our LinkedIn's if you'd like to connect. We're all on LinkedIn. Thank you guys so much.
Thank you so much. I just want to say that I think this is absolutely brilliant work and really, really inspiring. So we really appreciate it. Appreciate you guys coming here and talking to us today. So what questions do we have from our attendees?
Hey, thank you all three for this great presentation. At this time, folks are busily typing away, I believe, in the Q&A. I have a quick question, I think for Jala. In the introductory part of your seminar, you showed a bar graph and mentioned that there was a high percentage of individuals trying to get a vaccine. I'm just curious how you went about determining that they were trying, but obviously not getting a vaccine.
Yeah, that's a great question. I'll actually navigate back to that slide because I feel like it was, let's see here, very important work. And at first, it's actually straight from the Alabama Department of Health, Public Health site. And it's so interesting to me that they were the ones who came up with this. And so I'm not quite sure how they determined it, but you'll see right here at the top, they had determined people initiating. So I'm assuming maybe there were some metrics they had about maybe who was Googling the shot or calling about the shot. And so I just thought that it was very interesting that the people who were initiating, especially the African-American community, about 18.8%, however, didn't necessarily match up with those who were actually receiving the shot.
Well, hopefully that percentage has dropped over the subsequent months.
And I'm assuming so, because I actually looked yesterday and I said about 55% of people in Pickens County overall have gotten the shot now, and that about 45% are fully vaccinated. So they're still trending in the right direction.
That's great. No doubt because of this campaign.
Yeah, I mean, it's so, what's so interesting to me about your work, you know, this idea of counteracting disinformation and messaging and inaccurate information. It's very important and it gets a lot of attention, but you don't hear as much about the idea of like lowering barriers and equity and these other evidence-based things where you can make, seems like from your work, so many inroads by addressing those, right?
Yes, and that is the power of also good communication skills and knowing how to reach these audiences is kind of something we've been learning all semester. And so it kind of came full circle when we took a class on health communication campaigns and now representing this.
Wonderful. What other questions do we have?
Well, Michelle just posted, what do you think it would take for your campaign to be taken up and put into practice? And to what extent do you think that this campaign is still needed?
That's a really great question. We kind of thought about this when we presented it the second time and what modifications might we make, and realized that we probably need funding. Obviously, it's very intricate. And I think we would need a lot of support from community members, kind of some community buy-in for us to be able to do it. And we also thought about maybe even going house to house or even farm to farm, kind of bringing that mobile clinic to the farms, because we know people that have access have probably done it, and the people that are kind of still on the line might still be kind of hesitant. And so bringing the kind of getting in touch with community members and seeing what their thoughts are, maybe some focus groups, kind of understanding still that hesitancy or what resources they might need. I think bringing, you know, the clinic to the farms and just vaccinating on site might kind of help start that uptake. Thinking about the second part of the question, to what extent do you think the campaign is still needed? We're not at 100%, so it's definitely still needed. I think it would be, you know, kind of interesting to see what the numbers are now broken down by race and ethnicity and initiation rates, if those are still available. So it would kind of be a reevaluation of those numbers, but I'm sure it would be interesting. It would just, I don't know exactly to this point because we haven't done that research, but I definitely think it's still needed. Maybe just not sure exactly how we would do it.
Thank you so much. What other questions do we have from our audience today?
None that, but a great job, ladies. This is a fantastic idea, Megan. Transportation is definitely an issue for many rural areas. As it is right here in Birmingham, public transportation in particular.
May I ask a question out loud, just as a follow-up to Megan's suggestion? So potentially because I'm not from Alabama, even though I have lived here before, I wanted to ask about the door-to-door idea a little bit more. I've moved into an Alabama neighborhood and I want to get to know my neighbors, but I feel scared to walk up to their front door. Maybe it's because of news stories I hear where people across the country have been harmed when they go up to their neighbor's door. And I know Alabamans have like property rights more strong in their mind maybe than some other places. And I don't know, I just feel like some unease about it. I wonder if you think that that's really the case everywhere, like in Pickens County, or is it just Michelle being weird because she's from out of state or something?
That's a really good perspective, Dr. Wooten. And it's funny because it makes me think about, I was working on a national funded project called Communivax. And part of my research was to actually go to Pickens County. And it was very rural, lots of trees, no street lights, barely any stoplights. But as soon as I pulled into my participant's front yard, she was telling me to come on in and sit down. And, you know, you're not coming in my house and not sitting down to speak. And I ended up having an hour-long conversation with her, right? And so I think in Pickens County, if you have, like Megan was saying, some of those trusted individuals that can kind of go to bat for you, they would welcome you with open arms and definitely invite you in, even to talk about something as maybe critical as a health topic.
Yeah, I think maybe even bringing a gatekeeper with you, you know, a local pastor, a trusted pastor, a politician, or community member that's kind of crucial in that community. I think bringing them with you so they see you both when you come into the yard, or maybe doing kind of a neighborhood thing and getting in touch with the neighborhood association, or maybe somebody who can kind of be over the entity as a whole, maybe not going door to door specifically, but kind of smaller communities instead of, you know, trying to reach big parts of Pickens County.
Thank you.
And I would like to add one more thing on top of that too, from a communication component. I think it's important to have those close interpersonal conversations about this, because research shows that rural residents, they prefer to have simple messaging. And in particular with social marketing, a lot of the times it's advertisement based and we are really fancy and we try to get really creative. And sometimes the point that we want to get across in messaging kind of gets lost because we either try really hard to be creative. And so rural residents are like, keep it simple and I can understand you. And so if sometimes campaigns may not even need a lot of money, right? It's like Jala and Megan were speaking about earlier, just small knit communities going to them or having a central location to have these conversations could save campaigners quite a bit of money and still get the message across even more effectively.
That really helps because sorry, Lauren.
No, go ahead.
I just was thinking like, why didn't you just say like, we'll give you $1,000, anybody who wants to get it? But I see what you're saying. That's a really good point. Thank you.
Yeah. So I just wanted to know, to what extent do you think that a lot of the barriers that we see with vaccine uptake are a reflection of health disparities in general in our country? And does this map well to addressing other public health issues?
I can definitely speak to that one. I would say it definitely mirrors it. And I feel that, especially in rural communities, sometimes the more that you can address some of these other issues and other concerns, you start to really build that level of trust with them. So that sometimes it might even be about, again, addressing their transportation issue or addressing their myths and all of that to get them to even understand that the vaccine is something that's there to benefit you and not harm you. And so the more that you can kind of meet them where they are and address their concerns, whatever it might be, you can definitely gain that leg in or foot in the door to help kind of promote your health mission.
That makes sense. Thank you so much. Do we have any other questions for our speakers today?
None that are in the Q&A or the chat box at this moment.
All right. Well, again, I just wanted to say thank you so much for being with us today. It was an absolutely brilliant talk. And I hope you seek funding and make this not a mock campaign, but a real campaign, because I would love to see it. I think we all need something like this. So I'm thinking of look for the helpers, right? It's easy to get down when you say, oh, there's so much misinformation out there and we need to win hearts and minds. But then I look at your wonderful work and it's really inspiring and gives me a lot of hope for where we can go, everything. So thank you.
Yeah, you've set the bar high for next year's competition. Congratulations.
Yes, exactly. Well, I also want to thank our attendees. This is the last talk for the fall semester, but we'll be back with you in spring. So please reach out to us at sigmasiuab@gmail.com to stay in touch. And we will be sending out announcements via the email list and our social media. So thanks again. And we're going to post this to YouTube and we'll send that link out as well.
Thank you.
All right, take care, ladies. Keep up the great work.
Yes.
Thank you.
Bye.